Good afternoon and welcome to Webinar Wednesday. We're excited to have over 230 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday t-shirt for answering this trivia question. Today's sponsor, oneSOURCE document site, is headquartered in Utah. What is the name of the famous US train robber and bank robber born in Utah, who was also the leader of a gang of criminal outlaws known as the Wild Bunch? Answer now using the questions feature on your dashboard. While you're answering, I just want to remind everyone that if you've missed any of our previous webinars, you can watch them on our website, webinarwednesday.live, and still receive continuing education credit for the webinars that have occurred within the last 12 months. Also, I just want you to know that the scheduled MD Expo Irvine has been replaced with 3 smaller regional HTM mixers. We understand that the COVID-19 pandemic poses unique challenges for everyone, and we're committed to doing our part in restoring conferences to the HTM community. We understand that participants may be hesitant or unable to travel, so providing the local regional conferences will be able to provide valuable continuing education, networking, and vendor engagement opportunities in a slightly modified, smaller, shorter duration, less crowded, and safer environment. Please join us in Colorado in August the 19th and 20th, Wisconsin, October the 1st and 2nd, and California, December 9th and 10th. For more information, visit htmmixer.com. Okay, let's see who the winner of our Webinar Wednesday t-shirt is, and it is, where are we? Oh, Stanley Salkowski. Stanley, I hope I've pronounced your name correctly, but congratulations. Of course, the correct answer is Butch Cassidy. Webinar Wednesday would like to thank our sponsor, oneSOURCE document site. The oneSOURCE document site includes the most comprehensive online collection of IFUs and service manuals. 5 databases are available covering surgical instruments and equipment, tissue and implants, dental, biomed, and facilities maintenance. For more information, visit onesourcedocs.com. Our presenter today is Travis Horstman, Biomedical Advisor at oneSOURCE document site. Travis, you may begin whenever you're ready.
Okay, thank you for the introduction. So my name is Travis Horstman, and the webinar today is Cutting Through the Clutter, Improving Patient Safety Through Streamlined Preventative Maintenance Processes. And a little bit about me. I'm a former United States Air Force CBET. I have 7 years experience in 3 different medical treatment facilities. The last 2 years, I was managing a clinical engineering department. I've been with oneSOURCE for 5 years, working with the biomedical product, researching and developing and addressing the needs of clinical engineering departments. I'm also currently in the United States Air Force Reserve as a cybersecurity specialist, and I currently hold a CompTIA Security Plus certification. So the objectives of this webinar is going to explain the impact that clinical engineering departments have on patient safety. And I'm going to evaluate streamlining preventative maintenance through reducing variation in medical treatment facility maintenance activities, exploring new technologies and products, and having access to proper maintenance materials. I'm also going to talk about the importance of oneSOURCE in clinical engineering departments, and I'm going to show a short product demo and take some questions at the end. So patient safety is a huge issue for all medical facilities. Clinical engineering is a hub for all equipment-related issues and questions. So clinical engineers are often the experts when a user might not know how to operate a piece of equipment or needs to find the operator manual or something like that. So it's important that the BMETs are very knowledgeable about the equipment in their facility and know where to find that information when prompted. Also, with the advent of new networked equipment devices, they pose new risks that BMETs must manage. If they're managed incorrectly, it can lead to not like security risks that can cause variation in your equipment. So somebody could infiltrate one of these devices without you knowing if you're not managing it properly, and steal information or change the settings to cause harm to patients. And also tracking and performing corrective action regarding critical device alerts is managed by the clinical engineering department. So this is important if it's not managed properly, devices that need to be taken out of service due to a critical device recall might be missed if it's not managed properly, causing undue harm to patients. And in general, BMETs verify the safe and correct operation of all medical devices throughout the facility. So it's important that maintenance is done correctly and with the correct intervals, so operators know exactly how to use the equipment and that it's going to perform the way they expect under critical circumstances. And I looked up a study of critical incident reports, and it indicates that 30% of critical incidents are related to equipment failure. So that's just a way that the clinical engineering department is really important to patient safety. I think it's often overlooked in facilities how important the role of the BMETs, the HTMs, and the whole department is to patient safety. So streamlining your maintenance process through reduction and variation. So variation by definition is a change or difference in condition, amount, or level. And the variation in clinical engineering in general is just if your BMETs aren't doing the same thing across the board, it can cause an increase in critical incidents if technicians are performing incorrect maintenance procedures because of either unclear standards, say they're getting their preventative maintenance instructions from an old work order they found within your CMMS and just performing that without checking in the manual. If they're going to an old database of manuals that your hospital has put together that aren't necessarily up to date, they could perform a maintenance procedure that's not in line with the current revision of the manual, which can happen quite often. So it's important to have a standard process. You need to go here to get your manuals. You need to perform the preventive maintenance and document it in this way and reference your materials that you use. And also just in general, data sources can lead to incorrect data validation. And what I mean by that is when you're building your inventory list, if you've had a change in department head or processes of how you enter in your equipment to your inventory list, it can be quite confusing if the model that was put in the system is incorrect and all a maintenance technician is doing is looking at their inventory list trying to find the materials for this piece of equipment. It might cause them to have to go up, find the equipment, get the correct model number, and then they can get the proper materials to perform the maintenance on that piece of equipment. So it's important to have standard processes when you accept new equipment, when you perform, when you enter in the device class of the equipment, so you can classify your critical assets, and it can help with developing your AEM program as well. And also reduction and variation in your procurement process. If you have variation in your procurement process, it can lead to unnecessary expenditures. If a technician is going to one source and just ordering the part from what they can find from the OEM versus another technician going through some part sourcing application that you use versus going through your logistics department, you can end up spending more in each different area. So it's good to have a standard process that, okay, I need to order a part, I need to go through this process, check this program, check these sites to make sure that we're getting the correct part for the best price. And it can actually vary quite frequently, and a lot of logistics departments will know where to get. They have different sources that they can go to get cheaper parts than the technician who just needs a part real quick and might just order it. And another way to streamline your preventative maintenance process is the exploration of new technologies and products. So with the increased amount of network connected devices, it's going to drive new maintenance technologies. And one thing that looks like it's emerging is predictive maintenance, and it utilizes connected devices on the Internet of Things to predict failures before they occur. So this is different than the standard preventative maintenance, where you go to prevent the problem based on, a manual or a set of rules that this is going to fail at this time. This is actually predictive, so it gives you live feedback to how the machine is performing and the different kind of data points that you need to look at to identify a small failure and fix it before it causes a larger one. So it's pretty exciting to see this new technology come into the medical world. It's important to be aware of this maintenance strategy because these devices are becoming more commonplace. And like I said, daily maintenance reports can be submitted through like a cloud system by the users, and it can be analyzed using special diagnostic software by the biomeds, so they can identify when it might fail rather than after it fails, or just following a standard preventative maintenance procedure. And it's important to have your BMETs trained on these new technologies and maintenance strategies, because it's going to save you money if you have BMETs that are aware of this technology and know that this device is going to require something different than your normal maintenance activity that other equipment requires. And that kind of leads into the next point, which is utilizing your new products to track these two distinctive maintenance strategies. So maintenance activities are being divided into like old technologies versus new technologies. So the older technologies is the standard BMET rigmarole. You go out there, you fix it, you use your manuals, your tools to go fix it. And then the new technology is going to require more connected devices, more software, kind of knowing how to navigate systems electronically more so than physically. And you need to utilize your CMMS to determine the cost of service ratio between these two different maintenance strategies. This can provide efficiency for healthcare technology managers and improve efficiency. That means so it might cost, if it's an old technology, how much is it going to cost to maintain? Is it going to cost less because the procedure it doesn't require a lot of knowledge, or not knowledge, but a lot of specialized skills that this new technology might? And I think with the different modalities throughout the clinical engineering departments, you kind of have a taste of this. But as these new technologies are becoming more commonplace in standard equipment, it's good to track that it's going to take more time to do this higher technology device now, and it's going to take less time to do these technology devices too. So you can split up your biomeds and have them work more efficiently, and know that you have the right amount of people, and you can perform maintenance and keep everything current in your facility. And developing using like part sourcing software can also, it's like new software that can help you quickly identify parts, and even some can like tag common parts that are bought, so you know exactly, okay, this is going to fail, and it's easy to order. You can back order if you have a bunch of work orders coming up, and that can help you save time and money throughout your maintenance activities. And another big one that I think most BMETs come across is access to the proper maintenance materials. And so it's good to have dedicated policies that ensure proper and current maintenance materials are available to clinical engineering departments. This will obviously improve efficiency if your biomeds have access to the materials they need when they need them. So it's like, if you have the most current and correct maintenance procedures on hand and quickly accessible, it's going to reduce your maintenance activities for your BMETs. And you can verify the maintenance is being done properly if you know that the maintenance materials are available through HTMs. You can identify in the work order that you reference this manual and it was found here, and you can verify that you are performing your maintenance in accordance with the manufacturer's literature. That this is becoming more and more important. And like your procurement processes, when you do get a new piece of equipment, it's good to require that you get access to a digital or manual copy of the service literature when you procure your devices. That way you know you're going to have the right materials to maintain them. And also for their larger high-end devices that require manufacturer schools and purchasing requirements of the manuals, if you can track those through your life of the equipment. So it's important to know who's trained, where the materials are, and if their roles change, you have a plan in place to kind of transfer that knowledge to your shop. So everybody is working most efficiently and has all the access that they need to maintain your equipment. And like HTMs know where the expertise is and can perform in-house training sessions to transfer that knowledge, and that'll increase your department efficiency. And also a big one is just sharing the need for the proper materials from device manufacturers. I think if the community as a whole starts to speak out that we need these manuals to maintain our equipment and comply with all these standards that we're expected to maintain, I think that will help. I mean, and like I said right here, prior to purchase, you can ensure that your in-house maintenance is conducted. And having all these together quickly accessible, it's going to reduce your downtime of your equipment because you won't have to wait for a technician to show up. You already have in-house BMETs trained, ready to go, and it obviously reduces the cost of hiring that outsourced individual. So now I'm to the importance of oneSOURCE. And so oneSOURCE is a online IFU and service manual library. And so of all the service and maintenance manuals that you might need, as well as IFUs for your operators and users on the floors, as well as we have a facility maintenance product now that for all your facility maintenance needs, like your big air handlers and stuff, and your alarm systems and medical gas systems. So hospital staff can access manufacturer and in-house documents from one simple source for all their maintenance needs. This is going to reduce your variation because all of your technicians will be able to just go to oneSOURCE, get the manuals. Everything in oneSOURCE is updated, so you know it's current. And if you don't find your manual there, you can always request it, and we can get that manual for you. This source is becoming more useful because it can be implemented across multiple facilities. So large hospital organizations can get oneSOURCE, and they can implement it immediately to all their sites. And so now all their sites are using the same process to access their maintenance materials. And for those documents that you had to purchase or you had to go to school for, we have ways that you can upload them to our system so they appear seamlessly in the database for your subscription. So you wouldn't have to maintain two different pots of manuals. You can put them all on oneSOURCE and have it for all your facilities. oneSOURCE obviously reduces the risks of BMETs utilizing outdated maintenance procedures. BMETs, sometimes you might need to do a preventative maintenance inspection and you have a manual in your shop that you're just going to use, but you're not checking to make sure that a new revision or something hasn't changed in the manual, new test hasn't been revised to perform. So this is going to reduce the risk of that, and it's going to, make sure you're compliant and just improve patient safety. Because you can verify that you're doing the proper maintenance procedures, and that leads to HTMs quickly being able to validate proper maintenance that's performed, you can attach manuals directly to your CMMS work orders, and you can reference those in the work order, or even in our system. You can put a note where the preventative maintenance inspection is, and that's one way for HTML when they're reviewing the work that their technicians are doing. They can quickly go in and see, okay, I know he did the maintenance. He got the manual from oneSOURCE. I know it's current. I know he performed it in accordance with this procedure on this page. Or, I mean, you can go that in depth with the system. And just integration in general with part sourcing and CMMS software, which we're doing, provides integrated access to manuals, especially as new technologies become more complex to maintain. So with the new technologies become more complex, you're going to need more manuals. And through our integrations with CMMS and part sourcing, we kind of make oneSOURCE accessible from these different points of access. So you're always able to go make sure you get the validated manual, you're doing the right procedures, which is really useful as a BMET. And also access to proper training materials and in-house policies can reduce costs and increase efficiencies. So we have a system on our site that allows you to upload your facility created documents that you might want your BMETs to review or to reference, like SOPs, anything you'd like. I mean, the system is viewable across whoever has access to it. So you want to keep it to material that you don't mind people seeing, but it's really useful because you can put your SOPs, your individual processes right there in the system. It can be integrated into our system in a way where it can be searched just like any other document within the subscription that you, or with the product that you subscribe to. So I think it's really useful. We're continually developing that to kind of meet the needs as we see the need grow. And another great part of oneSOURCE is it's a completely online system. So there's no software to download. So BMETs can access manuals from any connected device, and that's providing clarity in maintenance procedures. So they could be out doing something else, and somebody on the floor tags them, hey, I need you to look at this, and they can quickly, on their tablet or a computer in the room, they can quickly look up the manual and find the procedure or the information about that piece of equipment that they might be asked to provide. And just technicians can access one simple source for all their documentation needs, which is just essential to reduce variation. I just think it's such a great thing for BMETs to all be on the same page, to get the same information from the same source without worrying if it's correct or if it's not. And so now I'm going to do a short product video. And so this is our search page. And this is the oneSOURCE document site. And we'll search the database here. I thought I had already searched it, I apologize. But just to show you how much individual catalog models and catalog numbers that we have, I believe we have over 61,000 individual models yet, 60,173 individual makes and models in this database. And it's, as you can see, the headers here, you can click on them and filter by them, any of these headers. One thing that's becoming really useful that a lot of BMETs like is the PM frequency. You can quickly look up a piece of equipment, you got the catalog number, you can see that the PM frequency is 6 months, and that information is drawn directly from that document. So whatever that document says is put into this PM frequency column here. This is the database that it's in. This is the date the actual manufacturer released the document, and this is the date that it was reviewed by us. So you see this document was reviewed in September. We review biomedical documents every year just because they don't change as much as some of the IFUs. And we'll search for a LifePak 12. There's two ways to search on the site. There's a standard search and a drop-down search. We'll do the drop-down search first. So we're going to select physio control. Categories, we're going to go defibrillator monitor. And then we're going to look at a LifePak 12. And aside from that, the standard search works the same way. You just type in these two grayed out fields. You would just type in LifePak 12 and your keywords. This is the description column that appears here to search. So we'll search docs. And not only do we have the manuals for the device that is important to maintenance, we also have discontinue letters, operating instructions, service manuals, anything that has maintenance or that's important to the biomeds. So we can show the document, and here you can see that this one has, and we bookmark our all our documents should have bookmarks so you can quickly access the important information. So you can see there's a discontinued letter right here. We have the operating instructions as well. And there's some different blurs about general maintenance testing. We also have the service manual, and you can go right to the preventative maintenance section. You can go to the performance inspection procedure quickly, and it's all accessible in this one source. And if you're searching for a document and you don't find one, we have a submit document request button right here. It's really easy to fill out. You just fill out as much information as you can, select what database you want it to be in, and you can even add notes saying, hey, I want this specific manual, this model, this revision of software manual, this addendum. So, and we fulfill those within like 2 to 3 business days. And another thing I talked about is being able to kind of build a database within the database, so you can quickly add documents to a category in your system by clicking the blue heart. So you can add it to, I have 2 categories here, OR2 or radiology. These categories can be anything you want. It could be a technician name. You can add it to multiple categories. We'll just put this device is going to be outside OR1. So we can just quickly add it. You can add an alternate name if your nurses or somebody calls it something different. Like I know a lot of ESGs are called Bovie machines by nurses. So you can put that in there so they can search it. You can also add a note specifically, and this is what I'm talking about. You can say the use procedure on page 5. It can really be anything you want. So this is a great tool for BMEDs to quickly, okay, I can look at this document and now I know, okay, I need to do the procedure that's on that page. But this is completely free form. It can be whatever your facility deems necessary. And you just click save and it adds to your categories. And so now it has a blue heart. And then you can review all your favorites quickly from the favorites tab. I don't have that many in here. So you can see I added that LifePak 12 I just added. This is a cloud storage document. So this is a document that's been uploaded by the user. And so this is the tool I was talking about that can easily be used to kind of upload those documents that don't fit into a manufacturer manual, but you want your technicians and your other staff to see. And it's a pretty simple process. You kind of just click upload document. They do need to be in PDF format. That's really the only restriction. And you choose the file from your system, and then you can also add categories in your cloud storage. The description column can be whatever you'd like. You can add whatever catalog number you want, and you can tag it to an individual manufacturer. So this is great if you're trying to tag it to a specific piece of equipment. So when they search for that AMX4 or something, this document also comes up. And then you would just click save and it would upload. And I've already uploaded some, so we can just go back and look. So this one is a in-house radiation policy for the AMX4. It's in the biomedical and equipment database. And these are the models that I associated with, just to see that you can associate one document with multiple models. So you can search all those factors are searchable. And there's also a bunch of other features on this that I'm not sure if I have time to review, but the recently viewed tab is a great tool. So you can go and quickly see, oh, I looked at this earlier. I want to see, I want to save it into favorites. So these are all the documents you've looked at in the last, most recently. So you can quickly like, oh, okay, yeah, I was using this earlier. I want to save it now to my favorites, and you can quickly do that. And your recent revisions is a tab. If a document is updated, if there is a change to it, through your favorites tab, you would put your email in, and if it is revised, you'd get a notification email, and then you would come to the recent revisions tab, and you can check which database you want to look for the revisions in, and you can see, okay, this document was updated, this is what was added, and this is what was removed from the document. So it kind of takes the guesswork out of, oh, what's going to change for this document that's just a new revision just came out. And this tool is great. I've gotten feedback that it's saving facilities money because they're able to do a lot more in-house procedures. A lot of large facilities like it because they can provide this service to all their facilities and kind of link them together. So they're all doing the same processes, kind of reducing that variation we talked about. We also do have a COVID-19 database on our system as well. These are items, this is like a separate database. All these items are accessible from our normal database, but these are ones we just tagged as COVID-19 related to provide that service to our customers. And we also have some great training and educational resources throughout our site. We have these webinars that we were doing weekly. We have more to come, but you can watch them and earn credits. This is great for the sterile processing techs to earn their CE credits. And I think that's just about the system. I hope you enjoyed the webinar, and I'll send it back to Linda here for questions. But I appreciate oneSOURCE for allowing me to do this, and I thank you for attending and listening.
Great, thank you so much, Travis. We've got a couple of questions. First question is, how is oneSOURCE different from free databases online?
Okay, well, I mean, there's been a lot of free kind of document databases that have been popping up. One of the main reasons that we're different is we have a team of people behind our databases. They're not static databases. They're always changing. They're always evolving. They're based off of customer requests. So they're the most current or usable or used equipment in the facility. And we are ISO registered company. So all of our processes are stringent, and we contact the manufacturer for everyone. So you're getting the data right from the source that you need. And a lot of these other sites are built on a sharing principle where they might find an old drive. I mean, I don't know exactly, but they might find like old data sources and just kind of put everything out there. They're not tracking if it's current, if it's verified or validated like we are.
Oh, great. So is oneSOURCE being used as a tool for compliance for BMETs?
Yes, yeah, I've dealt with a couple different facilities that specifically wanted to get this for compliance, and we worked closely with them going through their inventory list and kind of making sure we had all their manuals for the biomed side and also for their equipment side, so they were ready for that when that window opened up for them in the future. And it's happened a couple times, so it is a great tool for compliance because we do have that reliability. We're getting it from the manufacturers. So yes.
Okay, so how can hospitals identify security risks with network connected medical devices?
So, I mean, there's many different ways. I mean, having an IT professional is always a great way. There's these forms that have been issued. They're not required yet, but they're called Manufacturer Disclosure Statement for Medical Device Security, or MDS² forms. And they're forms that when you do purchase a connected medical device, you can request the manufacturer fill these out, and they'll identify specific security risks, like using old passwords, or it's connected in this way. It does transfer patient data. So these forms are kind of a really good tool to have in your disposal when you do start acquiring more and more connected devices. And they're called MDS² as well.
Okay, that's great. I've got a question here from an attendee that's asking, are obsolete models available in the database?
Oh yes, so that's a huge part of our database is obsolete manuals. We've worked very hard because we get our equipment from facilities requesting them, and there's a lot of obsolete equipment out there that facilities are still using. So we put in that time, call this manufacturer, it's been changed to this manufacturer, kind of go down the rabbit hole and get that manual or the documentation that you'll need wherever it may be. So that is a huge part of our database. We spend a lot of time going out there and trying to get kind of the most information on those devices.
Okay, another question here is, are there any particular CMS systems that oneSOURCE integrate with directly? We're searching for a CMS system at this time and need to retire our old database. Having this type of document availability directly integrated would be so helpful.
Yeah, well, if you want to get with me offline, I can mention all the systems that we're integrated with. We're currently integrated with 4, and we're working on a couple other big ones. I don't kind of want to put them all out there on this, but we can talk about it further. I have some great insight on that, but I'd like to do that privately if that's okay.
Okay, well, I can send you the attendee's email.
Okay, that'd be great.
Travis, so you can contact him directly then. Okay, another question here. Is there a list of equipment that could be an AEM program and their new inspection intervals?
Well, you can post, so all the data on our site, those columns, that PM frequency column, where we got the names and the catalog numbers, those all come directly from the manuals. So we're pretty strict that we only put maintenance procedures from the manuals, but with the cloud storage feature, AEM program documents can be put and tagged to those individual model numbers, and they can be added to your favorites. So anytime anybody searches for that equipment, they'll see the manual from us, and then they'll see your document, and it'll be described, this is the AEM policy, or maintenance interval for this piece of equipment. So there is functionality to do that within our system.
Okay, that's great. I've actually had another attendee saying he's interested in the CMS systems oneSOURCE works with. So I will send his name to you as well afterwards, as he would like to contact with you. Another question here is, how will this system help us eliminate the waiting on parts codes?
The wait. I'm sorry. What did you say? The waiting?
Waiting on parts.
Waiting on parts. Well, we're integrated with we're integrating with partsource.com. So we're going to have a system that's available through their I think one of their extended usage policies that you have to kind of subscribe to, but our manuals will be tagged to those parts. As far as ordering parts, we kind of have the manuals there available that'll have your parts list that you can quickly access. So you could be able, and it'll have the manufacturer contact information will be on there. And but it's important to have multiple sources when you're ordering parts. So I would encourage to kind of hit your different sources. A lot of facilities might have different part sourcing venues or avenues that they might go down.
Okay, that's great. Another question here is there a list of equipment that could be in an AEM program and their new inspection intervals?
Could you say that one more time? I'm sorry.
Is there a list of equipment that could be in an AEM program and their new inspection intervals?
Well, the AEM program needs to be kind of developed at your facility level, since this database is supplied to many different types of facilities that their AEM policy may differ. So that's not something that we would be able to provide, because it can vary greatly on your different type of facility, or based on your risk, excuse me, your risk management meetings or EOC meetings, where you determine, okay, this device can be done at this interval because we've decided and developed this process that it's safe to do.
Okay, looks like we've got one more question here. Some manufacturers are not providing the service manuals if no further training is needed. How do you manage to secure such documents?
So there are some manufacturers, unfortunately, that will not provide service manuals to anyone, and it's a small portion. I did a short analysis of our database earlier this month. It's around 9 to 10% of the manuals that are just not provided, and I would encourage, as a community, to reference us and these companies that, hey, we need to do our maintenance on this equipment that we own, and try to prompt them to kind of work with us and find a way for them to provide that specific information for you guys. We do contact the manufacturers, and we work directly with our customers. So if they do need to contact the clinical engineering department, we can make that connection happen and kind of facilitate kind of manuals that way if it would be more restricted. I hope that answers that question.
Okay, thank you so much, Travis. Just seeing if we have any more questions. One tick. Okay, that actually looks like it is. I will be sending Travis a couple of questions from a couple of the attendees who wanted answers privately, so I will do that directly after we finished here. So I think we can wrap up now. So thank you, Travis, for a great and very informative webinar, and thank you again to today's sponsor, oneSOURCE document site. Just a reminder that the post-webinar survey and certificate process is automated, so the survey link will be included in the follow-up email, which you'll receive in about an hour's time. Once you've completed the survey, you'll be able to download your certificate immediately, and one lucky attendee will win an Amazon gift card for completing the survey. If you have any questions, please contact us at webinar@mdpublishing.com. And for more information about all our upcoming webinars, please visit our website, webinarwednesday.live. Thank you for everybody joining us today, and obviously thank you to the HTM community for everything you do. Please stay safe, and we hope to see you next week. Enjoy the rest of your day. Thank you.